My name is Luchembe Chilufya. I'm the Executive Director for Alliance of Accountability Advocates Zambia, a youth-led organization that is focusing on promoting youth participation in governance and health-related programs. We are implementing a one-year project with HIVOS, which is focusing on enhancing adolescent sexual reproductive health and rights in Zambia, and we're focusing in 3 provinces, namely Muchinga, Copperbelt, and Eastern Province. The intervention that we've taken is, of course, first to start with engaging the local leaders in the provinces. This is to ensure that there is ownership from onset from the government, and as well as ensuring that when we demand for accountability, we know who we are engaging and they're already a part of the process from the beginning. Then we also go into training community youth-led organization and as well as adolescents in those provinces. So the training focuses on providing capacity to youth organization in social accountability, budget tracking, as well as sharing information on the adolescent sexual reproductive health services that they are supposed to access.
It was an interesting project and a very serious one for that matter, because their aim was to make sure us as youths know where to report to if our sexual reproductive health services are not according to what we want. Mostly we were talking about social accountability, budget tracking, human rights, and policy analysis. All this was in that they wanted us to know how we can demand for our rights. That's it. And then they also taught us the steps to follow when we want to do a social accountability case. And then if it involves funds, they taught us also how to go about a budget tracking, because there were also other steps to follow.
There are a number of steps that are taken for communities and indeed for adolescents and youth to be able to address the identified challenges in the community. So the first step, of course, will be for them, like I earlier said, to get the training to know how they can identify these challenges. Then after they get the training, they identify those challenges, and then they come up with the action plans, which we facilitate and provide the necessary support for them to be able to address those challenges. And also in ensuring that when they need to get in touch with local leaders, we are there to provide the needed technical support and ensuring that these local structures are well represented and they bring on board the decision makers, the duty bearers, to answer some of the questions and the challenges that the community is faced.
Social accountability, this is when you and I, service users and other people, ask questions to the, let's say, the service providers, public officials, for their decisions and actions that they are performing that will affect everyone.
And of course, the impact is that youth and adolescents are able now to participate in issues to do with adolescent sexual reproductive health, and local leaders are able to sit down with adolescents to address the identified challenges, and now access to services in the areas that we are implementing the project is becoming at least much better than it was before the project. We're seeing people being accountable on the decisions that they make when it comes to providing the services for adolescents. When we talk about, for example, issues to do with youth spaces in the health facilities, we're able to see that there is an inclusion of youth and adolescent spaces in those spaces, and adolescents are able to access the services without discrimination, without being judged because someone is an adolescent, and if they have to access certain services, they are supposed to go with maybe a guardian or a parent. So services are becoming available, and I think at national level we're seeing the realization in investing in adolescent sexual reproductive health.
I think what the AAAZ are trying to do is to make sure us as young people we have a good health. So if we have enough knowledge about the project, it's going to help us not to, let's say, not to limit ourselves. If we want to go to the clinic, we'll know who to follow, and then we'll know who to ask, and then there'll be no one to question us why we are there, because it is our right to acquire information when it comes to our sexual reproductive health.
So there are a number of positive aspects that are coming with the implementation of this project in the provinces. We are hoping that this project can be scaled to other provinces as well, to ensure that goal number 3, which talks about good health and well-being, is attained by 2030, of course. But of course, we also have national goals and national targets that has to be met. And as an organization, we want to collaborate with different partners, and we are grateful to HIVOS for having supported this project. And at least we are able to see that the needs and aspiration of the young people are being achieved.
Just after the training, I went to my community in a certain organization. I also had to share the information we had in the training with them. And then after that, I think there are a lot of things that us young people, we can account for that is happening in the community. And then this is what we're working on right now. We've noticed a lot of people are not given things that they require at the clinic. So we're trying to follow up why those services are not being provided to us.
These youths that are able now to take the mantle on holding their leaders accountable and engaging with their leaders in ensuring that services with regards to sexual reproductive health are addressed. We want to ensure that young people are well informed, so the training does not just provide the capacity, it also provides the information on, for example, what resources are available, how does government come up with a budget, a health budget, and how can young people participate. And this is what those that have been trained are able to do now. They're able to follow up with their leaders on the national budget and hold them accountable on how resources are being spent, and also going down to the community at a local hospital or clinic to find out what services are being provided, what commodities are available for adolescents. And I think that is a positive impact if young people are able to rise to the occasion to hold their leaders accountable, but also to hold themselves accountable in the sense that they're now responsible in addressing the challenges that they are faced. I think that is a positive impact that the project is bringing in the communities where it is being implemented.